I have no fear of diseases. I live by Ayurveda. Well, here we are talking about a science which has got 5,000 years in the making. Well, Ayu means life and Veda means science. So we are talking about the science of life, Ayurveda. And today the Medi biz TV camera crew is at the premises of Dr. Shyam's Ayurveda Center, and I am in conversation with Dr. Shyam. Hello and welcome to the show.
Namaste.
Well, Dr. Shyam, what is Ayurveda? And in fact, we would like to know about the definition of Ayurveda and the science as a whole, because there's always the so-called apprehension in the market that people are a little reluctant towards Ayurveda, or the mishap in the market. So we would like to clarify from your side as to the so-called Ayurveda, its benefits, its advantages, the gestation and so on.
As you mentioned, rightly, the literal meaning of the word Ayurveda is science of life. Mm-hmm. So it's a science, not only dealing with the treatment of some diseases, rather, it's a way of life. Mm-hmm. It's about, living in harmony with the nature. Mm-hmm. I believe, if Ayurveda were a religion, nature would certainly be its goddess. Mm-hmm. As far as human universe is considered, Ayurveda has different aspects, say like the Mriga Ayurveda, which is the study about the animals, mm-hmm. Vriksha Ayurveda, which is the study about the trees. Mm-hmm. As far as human universe is concerned, Ayurveda has two objectives. One is to cure the disease in a diseased person and to prevent the ailments or maintain the health in a healthy person. Mm-hmm.
So these are the two core aspects.
Two objectives of Ayurveda. Mm-hmm. Then Ayurveda has 8 limbs, which is otherwise called Ashtanga Ayurveda. Mm-hmm. It talks about different specialities of medicine, same like the general medicine, ENT and ophthalmology, surgery, pediatrics, psychiatry and psychology, toxicology, geriatrics or the study of tonics, and Vajikarana, which is the study of aphrodisiacs and reproductive issues.
So this is in a nutshell.
It's in a nutshell.
Will Dr. Shyam tell us something about yourself and about your institution as a whole?
See, I come from a village named Ochira back in Kerala. And I did my Bachelor of Ayurvedic Medicine and Surgery from Government Ayurveda College, Tripunithura. Mm-hmm. Then I did my MD from Trivandrum Ayurveda College with the speciality of Shalyatantra, which is the surgical aspects of Ayurveda. Mm-hmm. I came to UAE immediately after my MD. Mm-hmm. Previously, I worked with some organization, about teaching Ayurveda to Western doctors. Mm-hmm. I came to UAE in 2001 under the umbrella of Kempinski Hotels and Resorts. Mm-hmm. So when I came here, Ayurveda was an alien theme, for the country. There were a few doctors who were practicing here, but they were not really practicing Ayurveda as a system of medicine, rather as a massage practice. Mm-hmm. And I think, there were no MDs at that time. All graduates were practicing. So what I did, as soon as I landed here, I wrote to the ministry saying that, I'm an MD from Kerala. I would like to practice the system of medicine, as a medical system rather than a massage system. Mm-hmm. I remember, in the beginning, even the medias were reluctant to say, it's a medical system. Okay. Had to do a lot of, campaign, public awareness programs. That time, Indian consulate helped us a lot. Mm-hmm. Dr. George Joseph was there. He was the CG there. Okay. Then, especially Gulf News, mm-hmm. Malavika was there. She was very supportive to promote the system of medicine in UAE. Mm-hmm. I got my license, the first license in the country to practice Ayurveda in 2003. It was in 2003, Ayurveda got recognition as a traditional, complementary and alternative medicine. Mm-hmm. So from there, I've been working, under the same brand for almost 10 years. Mm-hmm. I introduced Ayurveda to several countries, say like Kuwait, Malta, Greece, Spain, Djibouti, mm-hmm. Egypt, Tanzania, but all based in UAE. Then I took a break for 2 years, to work with a corporate in India. I was heading a company, who had around 30 Ayurveda clinics in India. Then I came back to UAE just 2 years now. And though this institution is new, the organization is only 2 years. I have been practicing Ayurveda in the country for the last 14 years now.
14 years. And here you are.
Yeah.
Well, doctor, give us insights on Vata, Pitta and Kapha.
The physical health of Ayurveda revolves around, the concept of 3 doshas, namely Vata, Pitta and Kapha.
Okay.
Actually, this theory is based on the Panchamahabhuta Siddhanta, which is a theory of 5 elements,
Okay.
which is the air, space, fire, water and earth.
Okay.
According to this principle, everything in the universe is made up of these 5 elements. You can see the presence of these 5 elements even at the subatomic level.
Okay.
So coming to the doshas, Vata is an energy factor which is with predominance of air and space elements. The energy factor Vata, it governs the principle of movements. Like I talk because of Vata, you nod your head because of Vata, you blink your eyes because of Vata,
Okay.
I breathe because of Vata, my heart pumps because of Vata. So any movement in my body, it is governed by the energy factor Vata.
Yeah, you keep any motions.
Any movements,
Okay.
Say like it can be a minute movement inside a cell or a conduction of a nervous impulse from the brain to the fingertips. That's also governed by Vata.
Okay.
There are different types of Vata to govern each movement. I'm not going to the details. Now the energy factor Pitta, it's a fire dominated energy factor. Pitta governs the physiology of transformation,
Okay.
or it can be any biological or chemical changes which take place in the body. Example, food digested inside the mouth,
Okay.
or it's been digested inside the intestine, it's a function of Pitta.
Okay.
Or now a sound signal converting into a neurological signal, that's also a transformation, which is a Pitta function. Again, different types of Pitta. Now the energy factor Kapha, it's more of earth and water dominated.
Okay.
It governs the functions like the lubrication, growth, immune system. These are some of the functions of Kapha. So we all have these 3 energy factors and their subdivisions, which do the entire functions of the body, like 3 pillars.
Oh yeah.
So if these 3 pillars are strong, healthy, stable, balanced, you have a healthy structure.
Oh, that's the core.
So when there is an imbalance of one or more of these energy factor, there the disease comes. It's the same like the modern medicine. They say, when you have a healthy, perfect physiology, you have a good health. When there is a break in the physiology, in terms of imbalance of these energy factors, there the pathology begins.
Well, doctor, what do you mean by Panchakarma? Because we've been reading a lot about Panchakarma, but we need to hear from the doctor's mouth as to what exactly is Panchakarma, what is involved in Panchakarma, the detailed process.
As I mentioned you previously, the balance of Vata, Pitta and Kapha provides us health, and the imbalance of Vata, Pitta and Kapha produce the diseases.
Okay.
So the treatment is balancing these 3 energy factors, Vata, Pitta and Kapha. To balance these 3 energy factors, Ayurveda has 2 approaches. One is to pacify the imbalances inside the body itself by giving the medicines.
Okay.
Example, if you have a high fever, you take an antipyretic, you take a Panadol.
Yeah.
Same like, in Ayurveda, there are certain medicines, which will reduce the fever inside the body. Doesn't mean that the fever is gone.
It'll pacify.
Pacified inside the body. Or you have a headache, you pacify the headache, inside the body. Ayurveda also uses this approach, which is called Shamana Chikitsa, or the pacification treatment.
It's called
Shamana Chikitsa. What makes Ayurveda superior to other medical systems is because of its approach of Shodhana Chikitsa or Panchakarma or the detox procedures, by which you can try to eliminate the imbalances out of the body.
Which means you're detoxifying
the imbalanced doshas.
Okay.
As the word meaning, Pancha means 5 and Karma means therapies or treatments.
Okay.
So these are 5 therapies to eliminate these imbalanced doshas out of the body. They are basically Vamana,
Okay.
which is the emesis therapy, that is induce certain kind of vomiting, controlled vomiting
Okay.
by certain medications.
Yeah, I think you have to underline the word controlled vomiting.
Right.
Yeah.
See, again, the emetics, it can be of different types. Some of these can be gastric origin.
Okay.
Some of these can work on the vomiting center in the brain.
Okay.
So we choose the herb, according to the imbalance. The number 2, Virejanam, otherwise induce a purgation, that is induce a controlled laxation or loose bowels, by giving certain medications.
Okay.
Number 3 is enema, that is administering medicine through the anal tract. Number 4, nasya, or the nasal drops. Number 5, we use bloodletting also. It's not so much allowed in this country right now, but that's also a part of Panchakarma. See, while I'm talking about Panchakarma, the Ayurveda tourism, has made a lot of it has propagated Ayurveda a lot. At the same time, it has made some bit of confusions also. Panchakarma is not about massage therapies. As I mentioned, specifically, these are about 5 detox procedures. But massage therapies, or the oil therapies, these are performed as a preparation stage for the Panchakarma therapies.
Oh, it's just a pre-preparation.
As a pre-preparation. So, a Panchakarma therapy, it will have 3 phases. One is the Purva Karma, which is the preparation procedures, which includes the oil therapies and internal medicated ghees.
Okay.
The second part is the Panchakarma. We choose the right Panchakarma according to the imbalance of doshas.
Okay.
And post therapies, which includes certain rasayanas to be taken, certain tonics to be taken, certain pathyas to be followed. These it will have 3 phases.
Okay. Well, doctor, what are the different therapies available in Ayurveda? We've heard that there are a lot of therapies, but we'd like to have an insight, a falcon's eye view on the different types of therapies available in Ayurveda.
You can see that Shirodhara treatment, it has become an icon of Ayurveda. Right? Any brochures, leaflets, you see an image of Shirodhara.
Yes.
Actually, the treatments like Shirodhara, are you familiar of Kiri? It's like these compresses, herbal compresses.
Okay.
They massage with these warm herbal compresses.
Perhaps viewers would also like to know the exact meaning of Shirodhara. Perhaps if you could highlight to the viewers the exact meaning of Shirodhara as well during your conversation.
See, Ayurveda categorize any of these therapies. The therapies comes under the Purva Karma as a preparation phase of the Panchakarma.
Okay.
Or sometimes these therapies can also be done as a Shamana Chikitsa, which is a pacification process, like suppressing the pain inside the body, for example. So it can be used in 2 modalities, either as a preparation phase or as a pacification phase. Ayurveda categorize the therapies into different types. Some of these therapies, they are like dripping or drizzling kind of therapies. I will tell examples, say like Shirodhara. Like it's like a downy stream of oil is poured on the forehead and the head massage simultaneously. There's a treatment named Pirichil in which continuously pouring of lukewarm oil on the body. It's like an oil bath and the body massage simultaneously. So these are some kinds of drizzling therapies, or it's like a stream. The benefits are unique. There are some other therapies which includes rubbing on the body. For example, Abhyanga, they massage with the oils. Or a treatment named Udvartana or Udkarshana, where they rub with a powder, with a herbal powder. Now these are the second type of therapies. The third kind, it includes application of warm herbal compresses, like the Kiri. It can be of different types. Sometimes we do it with herbal powders. Sometimes we do it with leaves, medicinal leaves. Sometimes we do it with certain kind of rice named Nyavara rice. You call it like Nyavara Kiri. Sometimes we do it with egg. Sometimes we do it with turmeric. Sometimes we do it with sand. So each has unique properties. Now the fourth kind of therapy, it is the retention therapies, where you allow the oil or a medicated liquid to retain in the body, for a certain duration.
Okay.
Example, Shirovasti, where you fix a cap on the head and fill it with a medicated oil, for 30 minutes to 45 minutes.
You fill it on top, or how is it?
Like you make it like a chef's cap.
Okay, chef's cap.
Right, and fill it with an oil.
On top.
On top.
On top.
Right. Or, a treatment named Tarpana, where you make a dam around the eyes with...
Round.
Yeah, around the eyes with dough and fill it with a medicated ghee. It's done in cases like, optic neuritis or several conditions. For example, in the low back pain, we make a dam around the lumbar area and fill it with a medicated oil. These are the retention kind of therapies.
Okay.
So the therapies are mainly of these 4 types. One are the retention therapies, the drizzling therapies, the treatments which includes the heat application and also rubbing.
Okay. Well, doctor, we would like to know the scope of Ayurveda, or the benefits of Ayurveda, or the so-called the Ayurvedic impact, the revolution in this part of the world. It's become such an important thing in a person's day-to-day life. So if you could let the audience know about the importance of Ayurveda in this part of the world, we would appreciate.
The horizons of healthcare delivery system, it is expanding. And the fences are vanishing, between the systems of medicines.
Okay.
See, I believe, no system of medicine has complete answer for all the health problems, for the humankind.
Okay.
So if these systems can complement each other, that's the best thing, for the human or for the patient. I'm glad to see that, the trend is changing and, UAE is, getting like a nucleus of, such a trend set in the Middle East.
Okay.
Because it was recognized as a medical system officially in 2003. It comes under the department of traditional, complementary and alternative medicine. So sometimes, these can be alternative in nature to the modern medicine, or sometimes it can be complementary to the modern medicine. I don't think Ayurveda is something new for the Gulf countries, because there was a lot of, communication and interaction, which used to take place between the Indian subcontinent and the Middle East.
Long back.
Long back, Say like, Alexander, great Alexander, he has brought, so many physicians, from India. And several of these Ayurvedic textbooks, the Sanskrit books like the Charaka Samhita, Susruta Samhita and Ashtanga Hridaya, they were translated to Arabic language in 700 AD itself.
Okay.
Right. Even now, if you see, there are a lot of Arab patients who goes to Kerala for taking these therapies. See, if you look at, the patient statistics at the clinics, the lifestyle-related diseases, are getting contagious
as the days go by.
as the days go by, right? And I believe, Ayurveda can be, an excellent remedy for many of these lifestyle-related diseases. For any physician, who practice in UAE, the most common cases, which will reach him, say like the low back pains, or the arthritis, the knee arthritis, or the allergic respiratory issues, or allergic eczema, psoriasis, and several autoimmune conditions, wherein the modern medicine, do not have a complete answer to this. Of course, they give good remedies, but may not have a complete answer to it, wherein, Ayurveda can be an excellent alternative or complementary to such therapies.
What is the USP of Dr. Shyam's Ayurveda Center?
We try to propagate, the authentic Ayurveda. See, I believe in, I tell all my doctors that, be simple, rather than, showing gimmicks. Right? Stick to the core, stick to the principles and do it. And always, tell my team, to stick with a few things like bring Ayurveda to the primary care level. In India, there was a tradition of having, family physicians, where, each family used to have a doctor as the physician, and, they were considered as a part of the family. Right? That brought, Ayurveda to the primary care level, back in India. So here also, the doctor should be a family member of the patient. So it's about, a long-term partnership or a long-term relation between the doctor and the patient. I believe that The purity of water, it depends on the vessel in which it's kept. The strength of a weapon, it depends on the warrior.
True.
The same way, any system of medicine or any science depends on the person who uses it.
Okay.
USP for Dr. Shyam's Ayurvedic Center is my team. Now we have a great team to use this system of medicine in the right way.
Well, I have this little leaflet of yours, which I picked right from your reception. It says, "My hands are blessings from the Almighty. My hands symbolize His healing. I cast my hands in prayer and mend the ailing." How do you substantiate the statement?
Now the message is, as simple as, the devotion to the God, to the Almighty. Now, believe, the moon is full when it faces the sun directly. When the shadow of earth comes in between, it is eclipse.
Okay.
The same way, my treatment will be complete when I keep in touch with the Almighty directly. When the shadow of my ego comes in between, it is same like eclipse. It's like any doctor, might know 50 to 100 medications for a same disease. But you should remember, what you learned in your college correctly, and the diagnosis should be prompt, and you need to pick the right medicine, for that condition at the right time. Ayurveda call it like, kaipunyam, like, the blessings from the Almighty and from your teachers. I believe in that. I just try to represent it in that statement.
The mantra.
The mantra.
Having 14 years of experience in this part of the world especially, what is that one message that you would like to these wonderful audiences who are watching this telecast on behalf of Dr. Shyam and Dr. Shyam's Ayurvedic Center?
Ayurveda specify the objectives of life as dharma, that is one's duty unto oneself, to the humanity, to the society, to the nation. Reaping of the benefits of duty, otherwise called artha. Kama, that is the satisfaction of desires. And for some people, it is the attainment of salvation or liberation in different meanings. But one thing for sure, if you don't have health, you cannot attain any of these fourfold objectives. If you want to stay healthy, live as per Ayurveda.
Thank you for a wonderful time. Information's at peak, information's at straight. The next time we come to see you, we look forward to see you in bigger heights, better heights. Thank you very much for your wonderful time.
Thank you.
Thank you.